Health impact transfer, what is it all about? We are working for a healthier world. As a matter of fact, my career in pharma for so many years, where I was responsible for technology, including blockchain technology, was all geared about that. And actually, the company Pfizer, where I worked for, their slogan is "working together for a healthier world." And so I've really adopted that, as sort of my mission going forward as well. But how would you do that? And of course, one big idea is not letting people get sick in the first place. It's called prevention. So maybe you know that when you do something for your health, you want some better health, normally you focus on the short-term results. But actually, everything you do, what you eat, how you live, it has a lot of long-term results, and those are invisible, as we know. So the question is, why actually is prevention not working? And I have a few theories why not. So obviously, the most obvious reason is, of course, human nature, as we can all see. Probably you know the story of the man who goes to the doctor, and the doctor says, "You're really in a complete mess. You should stop smoking and stop drinking, and you should eat better, and you should get out of your armchair and do some exercise." And the patient says, "But doctor, do you think I'm going to live longer?" And the doctor says, "No, but it will feel longer." So we know human nature is at the basis of why prevention is not done. But the actual systemic problem is that we always focus our attention on what is urgent. So, one of the, probably all of you know the Eisenhower matrix, about what is urgent and efficient. So we always focus on the urgent thing, and when somebody is sick, when somebody is in pain, when somebody is about to die, well, it's important and urgent. So that is what we always focus on. And that means really that the entire healthcare system is focused on this urgency and puts all its attention and resources on that. And that has, in my opinion, led to a massive overinvestment in what I call repair medicine and a massive underinvestment in prevention. It's a gigantic market failure, which is really global, because in every healthcare system you will have this phenomenon, in advanced ones and in less advanced ones as well. And obviously we know how our healthcare systems are riddled with all these problems and agency problems and inefficiencies. So, in fact, if you did this analysis and would actually analyze how much of the money that you spend on healthcare is actually are diseases that are unavoidable. There are all these trends with aging population, multimorbidity, all these things, lifestyle changes in Asia and so on that all bring new problems. Well, a lot of those things are avoidable. So by one measure, this is almost three quarters. And so actually, we found one key problem, therefore, is maybe the money that's available to prevention. And maybe you also know a doctor who has told you, "Yeah, I know exactly what should be done." Everybody has an opinion, obviously, but there's really a consensus in the medical community. What should we do to address, future diseases? What can we do really to do prevention? And typically, they just don't have the resources, they don't have the money. In fact, sometimes doctors, and I don't want to say anything bad about doctors, but sometimes they come up with really funny excuses about that. For example, recently one doctor told me, "You know what? You're not actually ill. You don't have a disease. You don't have an inferiority complex. You are inferior." So that's just his solution. So if you look at economics, it's pretty obvious. You can actually, with a very little resource, very few resources, you can actually achieve this outcome of health, and you can do the math yourself. And I don't have to explain to you what unbelievable amounts of money we spend on curing diseases everywhere. And it's never enough, obviously, because we can always improve on that. But the point here is, I think, maybe we are spending on the wrong side. As a matter of fact, we have set a standard for our system, which is basically that the minimum that we should save for a given project should be 5 times of what we invested. And that's not even a lot. So our first project, which is in Austria, where we do a screen and treat program for pregnant women to prevent preterm birth, the effect is actually 1 to 12. So this is not an uncommon thing. And obviously, there are preventive measures that are not profitable because the economics are different, because maybe they're very long term. But if you focus on short-term projects, you can actually achieve this metric. So how do you do this? You know, we were thinking, well, if all that money is saved, well, somebody must have that money, right? So wouldn't it be great if we get some of that money back from whoever saves it, right? And it's treatment costs that are saved. You know, less people get sick, so you don't have to pay for many pills and you don't have to pay for treatment. Let's try to get that money back. So we actually need a system where, you know, you take private money, we solve a societal problem. In this case, it's the health problem, and yeah, then we get the money back once it works. And the key thing is once it works, after it has worked, which is great because for the payer at the end, he doesn't have any risk. He doesn't have to pay if it didn't work. Hey, wait a minute, isn't that a social impact bond? Do we have that? Don't we have that already? And as a matter of fact, in Israel, I think there's a quite established thing. So what's the problem with the social impact bond then? So why isn't that, if that's the solution, why don't we have much, much more preventive health? I think that's a valid question. I mean, the social impact bonds have been existing for 20 years, or maybe more. So we've been thinking, well, what is the problem of a social impact bond? One of the problems is that it's illiquid. You can't sell it. You can't buy it, right? You have normally only one project, so you are really exposed to one the risky thing, which either works or doesn't work. And if it doesn't work, your money's gone. It's sort of a very unattractive investment thing. There are agency problems too, by the way. So what can you do to address those? And let's talk about the riskiness of one project. Well, what about you diversify that away by sort of combining it together with many projects? And you can see that many projects have they're different, right? It's different therapeutic areas, different geographies, different project properties, different duration, different cost structures and so on. So you have to actually have a very good reporting system of how you put all of those together to have a really good investment fund, like an investment fund of social impact bonds. And you can see how bureaucratic that can be. You can see how difficult that is. As a matter of fact, we did more than a year of research to try to do an investment fund, and then finally we gave up because it was too complicated. Blockchain to the rescue. Obviously, with blockchain, you can actually achieve that kind of transparency that you need to cut through all that complexity of multiple projects. You can actually quantify the progress that you have in each project, the milestones. You can identify validators who put this information on the blockchain. All investors can see it, and you can actually have a transparency about this whole project and a whole portfolio of projects that at the moment in the financial industry is totally unheard of. As a matter of fact, you might have already understood that once an authorized person puts something on the blockchain, you can't really change it anymore. So you actually, all this auditing and recalculating, that's all done with, and it really reduces greatly the entire bureaucracy of such a system. As a matter of fact, the key reason why you need blockchain, apart from, by the way, significant global liquidity that you have, is that once you publish something, it is something that investors can trust. So, one more thing that I think we can bring to the table because you see, if we can therefore have this economics, actually we can invest a little bit more in the prevention to do something extra. Because you could do some random projects and maybe they work and maybe they don't work, and you could have some kind of strategy like that. But we went another step and we said, how do you actually get the rigor and the discipline and the certainty into such a preventive project? And we found out, well, the best way to do that is you make a clinical study out of it. So our first project is carried by the Medical University of Vienna, and they have an ethics committee, and they have a validator, and they have a supervision and all kinds of things. And every little data point is put into the study database, so they actually have scientific evidence of what has happened. So that's a very key input of how you can do that, because look, if every project is actually a clinical study and creates scientific evidence, now other people can just take this evidence and run with it for themselves. They don't have to use the private money anymore to do these important investments, which are profitable for themselves. They can make those investments themselves. Because clinical evidence is one of the main reasons why state actors, state insurance systems don't want to invest in these kind of things. So for us, this is a guarantee in some way, also anyway, helping sustainable change. And sustainable change is really, I think, not just, it's not something that it won't just work by itself. You need to realign the incentives. So economists will tell you what is mainly wrong with our healthcare system is that the incentives are misaligned, and we will have a system that will keep investors happy on the one hand, and on the other hand, we will have a much more effective way to reach what we actually want to reach. And I write here, it's more effective than normal charity. The effectiveness in charity is very important. But why charity? This is, as far as so far I've said nothing about charity. But if you think about it, in less advantaged economies, we actually have maybe the situation that there is no payer at the end who can pay you back. So what do you do now? You just don't do the project. So we thought that we siphon off 10% of our profit, 10% of the money that comes in from both sides, the investors and from the payers, and put it in a non-profit organization. So we can do the exact same project in countries that just don't have a payer to pay us back. And I'm very happy that at this conference I have the opportunity to speak to so many of you from those countries and from the organizations catering to those countries to actually start making real contacts and getting really such projects on the ground, and I'm very grateful for that. We have great plans, as a matter of fact. In the next 10 years we want to do 50 projects, and if you do the maths, it's going to mean billions saved for healthcare systems around the world, hundreds of thousands of people who will be saved from disease and suffering, and approximately 15 to 25,000 deaths should be saved as well. We are very open to all therapeutic areas, which includes cardiovascular, COPD, diabetes, mental health, you name it, anything, prenatal care, all of these things that really are very costly for the healthcare systems and that represent really the big popular diseases of our time. So, can we solve the whole problem of these inefficient healthcare systems? Obviously we cannot. We can just sort of marginally improve, maybe, right? But you have to start somewhere. And I think that such a system can be an enormous catalyst to sort of change minds and to really create facts on the ground. And I mean, even, I don't want to belittle the effects we're going to have. I mean, even the first project is going to probably save maybe 10 or 15 lives. I mean, it's not nothing either, right? But there's a vision at the end of this road. I don't know what this future is going to look like exactly, but I hope that we can be a catalyst for this new health ecosystem. And the vision is really, we want a system where we really talk, when we talk about healthcare, it's really not sick care anymore, which it is today, but it is true healthcare. That is really the vision. And we hope the result will be a healthier world, as we set out to do, but with less disease. Thank you very much for your time.